Hello everyone, Dr. Corey Johnson here with the Spine and Wellness Center. Today's video is going to be about carpal tunnel syndrome, which is something we've been seeing a lot of here recently. We've been getting excellent results with it. It's very commonly misdiagnosed, it's often overdiagnosed, and we want to address some concerns regarding this so that we can hopefully give you some more information and give you some insight if you or a loved one or friends are suffering, so that you might know where to get them to the right place to help them. Carpal tunnel syndrome officially is a compression of the nerve, the median nerve that comes through the wrist underneath the fascia, or the retinaculum as it's called, that goes around the wrist. It's a band of cartilage that holds all the tendons from the wrist, the back and the front of the wrist. If there's a lot of friction, a lot of motion from typing or repetitive use, then those tendons, as they glide or slide underneath that retinaculum, cause friction, which causes inflammation, or inflammation of the bursa, which is like bursitis, and that's inflammation, that fluid accumulation, swelling, is what causes irritation or compression of the median nerve, which gives you that burning, that numbness, that pain, that tingling in these fingers. Common diagnostic tests used for this are NCV, or a nerve conduction velocity test, or an electric diagnostic study, where they put electrical probes or needles in the tissue, and then they test the impulse moving down and moving up to see, okay, where does the impulse diminish? It's not a very accurate test, a diagnostic test. It doesn't have a lot of high specificity, high sensitivity for this type of injury. So it will show a false positive in a lot of cases where, yes, it will say you have carpal tunnel syndrome, where in reality it's not true carpal tunnel syndrome. The reason we know it's not true carpal tunnel syndrome is because we're having the percentage of patients that go and have the retinaculum trimmed or snipped surgically to relieve pressure on that nerve because they've tried everything else, is causing them to not have any relief. It's not causing any symptomatic relief. Therefore, you know it's not carpal tunnel syndrome because it's not relief from the area where they were treated. So what we're seeing a lot of misdiagnosed carpal tunnel syndrome is actually coming from a couple of places. Depends on the situation, but it can come from the neck, called thoracic outlet syndrome, which basically means the joints in the spine are fixated or locked up, and then that, combined with tight muscles, hypertonic musculature, poor posture, those types of things, can cause nerve compression of the brachial plexus, which is the nerve bundle that comes out of the neck and the upper back. It goes underneath the clavicle, the collarbone, goes underneath the pectoralis muscles, especially pec minor, and then it goes down the arms. If the pectoralis is tight, if the neck muscles are tight, if the joints are fixated, you can get nerve compression, nerve irritation, that by the time it goes through all the musculature of the arm down into the hand, there is the numbness, the tingling that represents or is very similar in presentation to the carpal tunnel syndrome. What we find is if we address the tension in the muscle, the fixated joints, the posture, by doing a few adjustments, a few simple exercises, some home exercises that you can do, which would involve a lot of pec stretching, neck stretching, and we will go in more specific for that in a later video, that we can give a lot of relief, if not full symptomatic relief, of these conditions in a very short period of time. Obviously, modifying the daily activities that would drive these stressors are important, or at least addressing them so that you can reduce the amount of strain in a ergonomic setting if you're on the desk, or what kind of repetitive use you're using with that wrist. But there's a lot we can do for it in reducing and completely alleviating these symptoms. So with the carpal tunnel syndrome, be sure before you go have surgery, be sure before you go diagnostic testing, you see a chiropractor at one of our spine and wellness clinics so that we can assess that issue and make sure it's something that you're not getting misdiagnosed, make sure it's not something that you're missing. Dr. Corey Johnson, Spine and Wellness Centers, thanks for listening.